All right, Jamie. Tonight in Good Health, a woman says she lost years of her life because she didn't ask one question of her doctor when he suggested a different drug for her.
And now she's sharing her story, hoping that others will learn from her lesson. Dr. Frank McGeorge is here now to explain. Hey, Doc.
Hey, Jason and Sandra. Yeah, you know, when people get new prescriptions, they usually don't look at the list of side effects. Well, one woman started receiving the birth control shot Depo-Provera, not knowing all the side effects. And she became one of the less than 1% who developed life-threatening blood clots in her lungs. Marilyn Whiteman thought losing weight would ease her sudden, mysterious shortness of breath in 2009. It didn't. Then she fainted on the stairs.
First question my doctor asked was, "Are you taking Depo-Provera?" And I'm like, "Yeah." He's like, "Oh, that's it. Really? This is what we're doing?"
He put her on blood thinners, but she was in and out of the hospital until last year when her doctors told her that without surgery, she had a 10% chance of living 5 years.
In a very small fraction, however, patients develop a response to the clot where the clot breaks down. Then you start to develop scar-like plugs that obstruct the vessels and make it harder and harder for the blood to be pumped through the lungs.
In a 6-hour procedure that left this scar, Dr. Mulligan removed 15 clots mixed with scar tissue from Marilyn's lungs. First, he had to raise her oxygen level, lower her temperature and metabolism, stop her heart, and drain her blood.
You work very quickly to expediently tease out these clots that are multi-branched without puncturing the vessel, which is wafer thin.
Somehow I feel like you cheated and I wasn't paying attention.
Marilyn says she wouldn't have taken Depo-Provera if her doctor had told her about the blood clot risk.
So I'm telling my story because I want at least one woman to ask the question when your doctor is trying to give you a new drug. Ask the question, what are the side effects?
Now, it is really important to point out that Depo-Provera shots are not the only contraceptives that increase the risk of blood clots. In fact, traditional contraceptive pills, oral contraceptives, are linked to an even higher risk, and you should discuss that with your doctor, especially if you have a history of cancer or a history of blood clots in yourself or your family. And no matter what drug it is, you should always talk to your doctor about the potential side effects.
Yeah, we should know this. Just the commercials alone, when they list the side
It's
effects
enough to
of all these
scare
drugs.
you,
Yeah.
right?
Yep.
Yeah.
You have to know them.
Thanks,
All
Doc.
right. Thanks so much, Doc.
Now here's a